Ladies and gentlemen, dear colleagues and friends, I'm really happy to open this webinar on the COVID-19 pandemic, and the title is Better Aligning Education and Health. The idea is to see how the two sectors could work together at the local level, at the level of the schools. As you all know, 90% of the world's student population means 1.5 billion children and young people in 190 countries were deprived of schools. This has a huge impact on learning and also socialization. School teams had to face an incredible challenge, and they were expected to create virtual learning environment for their students while they waited to see where and how their schools might reopen. The closure and reopening of school during the COVID-19 pandemic led us to have a better understanding of the impact of inequalities on health and education, and it raised a lot of questions. United Nations, many countries published guidelines on the safe reopening of schools. But you all know that taking political decisions is one thing. Reopening schools in the field, overcoming own fears, welcoming children, dialoguing with parents, reassuring the community, setting all logistical and organizational issue is another thing. What do people in the field think? What they do? How to support them concretely are in fact the key questions. Because what counts is the people. And I just would like to quote a philosopher of the 16th century who said, women and men are the only form of wealth. This is clearly where we are. We're going to talk about the people, students, parents, professionals. That's why we organized this webinar together with ASCD and Education International in order to see in what way the collaboration between people from different sectors could help in the field to improve the quality of the reopening and to be sure that we do not left any children behind. In this webinar, we're gonna present the results of a global survey on the reopening of schools, as well as a new support tool for global guidance of schools called Forward to School and published by Education International. We're gonna ask 3 questions to you, the panelists, but also to many people, the one who are the attendant of this session. What have we learned from the field about the successes and challenges of reopening the school? This is the first question, and we're gonna have a kind of overview at the global level with Nicola Gray, which is the Vice President of the International Association for Adolescents' Health, and also a member of the Steering Committee of the UNESCO Chair. We will try to identify the changes, how this crisis affecting of changing education with a slate from the ASCD, and was also a member of the steering committee of the UNESCO Chair. And finally, we're gonna focus on the perspective of the teacher's profession on the pandemic with the Education International. So the first question is, what have we learned from the field about the successes and challenges of the reopening schools? In French, la réouverture des écoles du point de vue du terrain. This is going to be given by Nicola Gray. Please, Nicola.
Thank you, Didier. I'm delighted today to be able to present data from the UNESCO Chair Global Health and Education Research Group about what we have learned from the field about the process of reopening schools during the pandemic. So I've been working with the UNESCO Chair team for over a year now as a partner from the International Association for Adolescent Health. I'm committed to their work to better align health and education generally now brought into sharp focus by this pandemic. The context was that when we distributed this survey in May 2020, many schools had closed in haste as part of national lockdown measures. COVID-19 had spread through Africa. It was particularly through Asia. It was particularly right in Europe at that time, but was only just penetrating Africa and the Americas. The value of this survey was to collect perspectives from professionals in the field, their first-hand accounts of whether and how their schools were reopening, and the successes and challenges of making this happen. We had 192 responses from 42 countries and one multi-country region. You can see that 20 countries reported that they had access to guidance with green dots. That didn't necessarily mean that schools were open, but they had access to the guidance for doing so. 22 countries were still waiting for guidance and schools were closed. And one country, Burundi, in the yellow in the middle of the map, reported to us that their schools were still open and no interruption to education at that time. We believe that this map shows a general global north, global south divide, with many high-income countries already having guidance and many low to middle-income countries still waiting. We asked the respondents to describe their guidance to us. We didn't check the documents. We wanted to know their sense of it. Most reported that there had been input from both health and education ministries to the guidance at national level. The public health priority was clear. The interrelated issues of class size reduction and social distancing were described by respondents from 17 out of 20 countries. Hygiene measures were also widely described, making sure that hand washing stations, sanitizer and plentiful water were available. Transport and canteen arrangements were also often noted. Some had moved to private transport only, meaning that responsibility was placed on parents, but others were using distancing techniques on buses by reducing the number of seats available. Regarding canteens, many were closing and remaining closed so that students would have to bring their own meals, but some were preparing and placing plates on tables rather than asking students to come to the counter. Extra cleaning, mask wearing, schedule changes, including part-time attendance or staggered starts and finish times, and circulation changes, such as implementing a one-way system on corridors, were other features mentioned. We asked questions about the educational approach in the time of the pandemic and the nature of education being offered about the pandemic in schools. Several countries described materials being used. Switzerland offers a YouTube film to students about the return to school and what to expect. Iceland cited My Hero Is You, a storybook with wellbeing strategies that's been produced by the UN Interagency Standing Committee in over 100 world languages. The National Health Service in England, promoting its hand-washing song there for young children. A fact sheet for older children in France, including information about why schools were closed, and an adaptation of the UNESCO Chair in Global Health and Education REBE programme, Réussir, être bien, être ensemble. This is an initiative in New Caledonia with activity sheets that could be downloaded and printed at home, including the nature of microbes and media critical literacy. So now we've moved to reports and perceptions of the process, starting with successes or levers to success. One strong theme was the symbolism of reopening as a sign that the country was getting back to normal. The level of infection was low enough to permit it, and there was a perception of safety that this could happen. At the time of the survey, respondents from some of the countries expressed relief that there had been no increase in infections nationally at that point. But the restoration of lockdown in Melbourne, Australia last week, after a spike of new cases, including only partial reopening then of schools after recent holidays, shows that we must expect the turbulence to continue. Good teamwork in schools was perceived to be very important, with reports of teachers learning fast and being adaptable in this situation. Partnerships of schools with families, local authorities and teachers' unions. Clear, consistent guidance was vital. Having that and the resources and equipment that was needed should lead to successful adoption of the recommended measures. Successes also came from the goodwill, dedication and commitment of staff. And these are all beautifully summarised by one of our French correspondents: political commitment of communities, creative spirit of teachers and principals, anticipation time, partnership, inspiring and guiding resources, and not least, the opportunity to exchange practices between schools, learning from each other. Regarding challenges, in some ways it's the mirror images of the successes. The most widespread challenge reported was safety concerns and the resistance to reopening. The word fear was used frequently, leading to significant absenteeism of students and staff. Lack of time to prepare, a lack of resources, a lack of equipment. Logistical issues, problems within school premises. So, for example, corridors that were too narrow or classrooms that were too small for social distancing. Concerns that education would suffer at that time. Many recognised that students may only be in for several days a week rather than full-time to create those reduced class sizes. The challenge of hybrid education, some students face-to-face, some still on virtual platforms at home, was also reported to us. Contradictory information, communication challenges did not inspire confidence nor help people to get ready. Mental health problems among all groups, staff anxiety and fatigue, but also for students and families. And then that lack of consultation, lack of local empowerment, lack of trust. So again, a mirror image of successes. A super summary again here from a correspondent in the United States: the increased but necessary burden of extra disinfection, managing social distancing by scheduling or space reorganisation, communicating with parents, managing school meals, mental health problems, keeping staff safe and finding protective equipment. All these problems very much in people's minds and shared with us. Among those 20 countries who gave extended responses about waiting for guidance, they shared their insights, hopes and concerns about what that guidance might contain. And they could anticipate what would be in it because their countries were providing public health education more generally about the pandemic. For example, I remember a response from the Republic of Ireland about a Be Media Smart campaign to combat fake news. Many of these respondents were very keen to reopen schools. They recognised that conditions were not ideal for their students at home. A response from India, for example, noted that only 50% of families had adequate access to the internet so that they could take advantage of those virtual learning options. They were worried about widening gaps. There were practical concerns on this particular point that the guidance would come out just before the reopening, and so they would not have time to consider it fully and to implement all the measures in the way that they wanted to. So they wanted clear and flexible guidance, adapted to the local context, and to be able to learn from other people's good practice. A regional correspondent from Latin America shared a concern about young people not coming back to school. The economic impact of the pandemic could result in adolescents being sent into very unstable work markets to bring income into the home. A summary from India here underlines the needs for clear and adaptable guidance, clear roles and responsibilities for all stakeholders, checklists, and the sharing of good practices by places that have already reopened. So, our reflections. The guidance prioritises public health and hygiene measures, arguably with less emphasis on the educational impact and consequences. Cooperation between local stakeholders is vital for success. National guidance must be operationalised at the local level, and we need people to buy into it. There were scarce mentions of local health providers. Only our French respondents mentioned school nurses or paediatricians. So from my healthcare perspective, I wonder whether healthcare providers who know those schools and know those families locally could be good resources and good advocates. The long-term impact of widening inequalities for children and youth if education is disrupted is an issue. Resources have been variable in terms of information and its consistency, but also in terms of equipment that is needed to implement measures. And sharing of good practices is needed, to which end we hope this survey has been a meaningful contribution. Thank you.
Thank you so much, Nikki, for this talk. It's a brilliant summary of what we learned from the field and from the people in the different countries. Now we're gonna leave the floor to Sylvia in order to have an idea of what are the questions and the remarks from the participants.
Thank you, DJ. We've received several questions, amongst others, in regard of the healthcare guidelines. How do you protect education workers and students when they return to school? And another question is, what should be the position of the union leaders regarding the health measures to be given to teachers and students when they return to classes?
Thank you so much, Sylvia, for these two first questions. Perhaps the first one for Nikki, and the second one could be for Antonia, as among this global leader of the Teachers Union. Nicola?
Well, there was a great variety of methods that were being used to protect both students and teachers at this time, and all kinds of ranges. So some of the countries were creating bubbles where social distancing was minimal among the students, particularly with younger students, but where the teachers either were still socially distanced from the students, or where teachers were being kept with one particular class, a slightly smaller class, throughout the day, so through the taking of meals and through all lessons, and in the same room for those days as well. So that was one way of reducing the number of contacts for all of the class while they were in school. But there were certainly a lot of concerns among teachers about how they would remain safe. And we also saw significant absenteeism for teachers who were either shielding themselves because of a particular condition, or perhaps had other people in the household who needed to be shielded. So whilst many people at this time were anticipating what was going to happen, even if they had guidance, this was a very live issue.
Thank you. There's a question from Marianne in the chat box. How do you apply the sanitary measures for class with more than 45 students? What did people say about that in the survey, Nikki?
To be honest with you, I don't know whether we had a good answer. That it was apparent, particularly from some of our correspondents in Africa, that they were struggling to see how they could create smaller class groups, with these class sizes. But I think that it was going to come down to scheduling, that, accepting that children were not going to be in all week, and that there would be different groups who would rotate through the schools. But this was seen as a huge issue, because most of the class sizes that were reported for social distancing were 15 to 20 students maximum that they could have in one place. Really, so I think this showed again some of the inequalities that we see widening.
Okay, so in general, when you have 45 students, it means that you make 3 groups of 15 students, and you organize the learning activities in the school and at home. Antonia, what could be the positioning of the union leaders regarding this question of school reopening?
Thanks so much. I think the first point is probably dialogue, the necessity of union leaders having a continuous, ongoing dialogue with the relevant authorities, so that union leaders, educators, teachers, and education support personnel can provide some of the specific expertise that is required to really find ways of merging what might seem like quite a difficult equation, health and safety measures that we've never seen in school contexts before, maybe, and yet the absolute necessity to introduce these. So I think the first point would really be about dialogue and the necessity to have an ongoing dialogue. The second, I think, would be transparency. So public authorities being transparent about the evidence that they are relying on, making sure that union leaders understand what their considerations, what their suggestions are based on, because that will allow the union leaders to also then have conversations within the union and get feedback and input from the broader membership. But I guess I'll give a bigger and longer answer a bit later in the webinar.
Thank you so much, Antonia, because what is the most important thing is that you cannot reopen schools without the professionals. We need to create an alliance between, of course, the institutions, the administration, but also the teachers themselves, the parents and the students. It's a key condition for school reopening. Sylvia, another question, and I remind all the participants that they're invited to give their answer about the level of cooperation between health and education sectors on the reopening of the schools by clicking on the link to WooClap or using their cell phone to contribute to the webinar. Sylvia.
Thank you, DJ. We have a question in relationship to the schools which remained open or have reopened. If there is any data on the level of absenteeism among teachers who are either immunocompromised or worried about family members who needed to be protected. And another question is, in the face of social inequality and the enormous social gap, how can we provide educational assistance to the indigenous population to prevent them from dropping out of school?
Wow, this is two really, really important questions. So, Nicola, what do we learn from the survey in terms of absenteeism or reluctance or difficulties of the teachers? What do they say about the question of their own safety? We have to take that into account. What do we learn from the survey about this question, Nikki?
Well, the levels of absenteeism were significant and varied widely. And if you remember, at this time, it was a minority of countries who had actually gone back. There was a much larger group who were still waiting to do so. But one of the comments that I particularly remember was about, it may have been one of the European countries where they had now had 2 stages of return. And they had seen that in the first stage, you know, significant absenteeism. But as time went on and as people kind of got confidence in the system and there were reports from families who had gone back, that the absenteeism was reducing, at least among students and families. But there were ongoing concerns from teachers around the supplies of personal protective equipment. So ways of mitigating, you know, if social distancing wasn't always going to be, you know, 2 meters, or working with younger children, whether there were, you know, possibilities for personal protective equipment. But I do remember another quote saying, you know, what kind of environment does that then create in the schools? You know, one French respondent saying, you know, they're scared of our masks when the younger children came back. So I think it is an ongoing, it is an ongoing conversation, but that there should be equipment there, and you know that hopefully as the return goes on, the absenteeism will reduce. The Netherlands also have some really interesting data on their public health website about transmission between children and between children and adults. And it's there in English. We could put the link on at some point, but I think that has reassured people in the Netherlands as well, that there's ongoing monitoring of infections in schools. It's not that everybody's gone back and, you know, nobody's looking. People are actively looking.
Thank you so much. And probably when we have this question in mind about absenteeism, this is just because many people think at reopening as a kind of punctual event. In fact, it is a dynamic. We need to build trust, and we have to acknowledge the fact that it takes time for parents, students, and professionals to find a good balance between, I would say, the learning objectives, this is the mission of schools, and the safety of all the people. Thinking at this phenomenon as a dynamic help us to have a better understanding of what's happening in the different countries. The last question with a very short answer. What do we learn from this survey about the most vulnerable students? Is there any initiatives or nothing, or it's too early for indigenous people or I had that to the question of the participants, but also to people living in the very disadvantaged areas. What kind of measures, specific strategies were developed in the different countries to trying to reduce the gap instead of widening the gap? Nikki?
There were not many mentions of initiatives in the countries, but I do remember that there were teachers going out from some schools to families that they felt may have problems, so that they were trying to, you know, find out about their students and how they were coping with the pandemic. And many schools also said that they had remained open if students wanted to come to them, that there was a small staff in the school and that students could come in. But I think that that is something that needs more exploration.
Thank you very much, Nikki. We can see some initiatives, as you say, but not many. What we learned from the survey is also that in the most disadvantaged places, you need to use different means. It means radio, TV, and not only the internet in order to reach the most vulnerable students. Thank you for your answer. Sylvia, it's your turn. Now, what do people, the attendants of this meeting, say about the level of cooperation between health and education sectors on the reopening of schools? Okay, so it seems that on the basis of the feedbacks, we are at 5.6 on 10. It means it's very far from 10. So in the different countries, the cooperation is existing. This is what we can observe, but it's not systematic. So we have a lot to do. We have a lot to do. This is only the beginning of a process, because, you know, the cooperation is absolutely not simple, and we have to move forward. I suggest that we keep this data in mind. The participants rate the level of cooperation at 5.6 on 10. So there's probably a lot to do, and I will ask all the participants at the end of this webinar to react and say what they think in relationship to this analysis of our participants. Thank you so much. Now we're gonna move to the second question. Now we're gonna ask Sean Slade from ASCD, in charge of the global outreach for ASCD, to tell us what he thinks about the impact of the question of the crisis on the future of education. As always, dear participants, you're going to have to contribute, and we would be happy if you can send us 2 keywords, just 2 words, on what are the best levels to improve the cooperation between education and health. These words could be in French, in Spanish, or in English. To do that, it's very simple. Just go to www.wooclap.com/13 July 2020. So, Sean, what will gonna change in the future?
Thank you. Thank you very much, Didier. And just so people are aware of the talk that I'll be presenting and where we're coming from, ASCD is a global education association based in the US, in the Washington, DC area. And so we're talking about COVID-19 as it pertains to schools and education. And I think a lot of what Nicola was outlining in her talk is going to be repeated. And just to, before we move on to the next slide, just to answer the last question about disadvantaged students, I think it's key that we all understand what our locus of control is. And so for the teachers and the educators, yes, there is a myriad of things that we need to address or would like to address, but there are certain things that we have control over. And the best things we have control over, as I'll start to illustrate in this talk, is maintaining relationships with our students, developing and enhancing sense of belonging, and building that community, because that will start to be a protective factor against some of the traumatic effects of COVID-19. Next slide, please. So really, you know, I'll start off with a summary of what I'm talking about and what we're getting into and what we're seeing via this crisis is really our own Maslow before Bloom event. And what we mean by that is we need to think about the hierarchy of needs that Abraham Maslow outlined before we start thinking about the taxonomy of learning that Benjamin Bloom spoke about. And so it's an understanding that we need to focus on student and family and community and educator well-being, health and safety before we start to worry about cognitive development. And if we don't, we're going to be hamstrung and held back. Next slide, please. So what I want to talk about in the next 10 minutes is really just some of the strengths, but also some of the issues that are coming out of this crisis that we're seeing from a K-12 education perspective. Next slide, please. And there are things that we can weigh up on a scale. There are strengths that we're seeing. There is a desire for normalcy. We're seeing a desire and a need for community being developed. Well, one thing that's a very strong positive as well is we're seeing this understanding in the majority of schools and districts and countries for expertise, whether it's expertise around health and well-being and advice from the Centers for Disease Control or the health departments in various countries, or even an understanding from parents and community about the expertise of teachers themselves and what they are doing. But one of the strongest things that we're seeing in terms of strength is an understanding that well-being is critical to an effective education and an effective education system. However, we're on the flip side, we're also seeing growing levels of anxiety. We're seeing increased vulnerability, especially from those communities who are consistently disadvantaged. And we are also seeing the effects of students and teachers and families coming from trauma and varying levels of trauma. Next slide, please. So focusing on, we'll focus on well-being and we'll focus on trauma. But one of the positives that we're seeing coming out of this crisis is this understanding that well-being is a critical part of education, that there is a universal reappreciation of the need to focus more on both our individual well-being, but also the collective, the community well-being. And we've seen this, whether it's via the opera singing in Italy, or whether it's the applauding of the health workers in New York, or more recently, you know, watching the English Premier League and the affirmation of thanks and reward to the National Health Service that's going on. There is a universal understanding of well-being and support. There is also an understanding from teachers themselves that well-being is a critical part of what they do. And it really needs to be pushed to the front of the educational priority list. Next slide, please. And we've seen examples of these things across schools and districts, especially here in the US, whether we've had drive-by parades where teachers or families are supporting students who can't get out of their houses or teachers who are locked away. There is this understanding and this need, almost a human need, for a sense of belonging and a sense of security. And this has been pushed not only by teachers, but by families, by parents, but also by the education support professionals as well, who very often have been the frontline people handing out meals, serving students, going door to door to make sure that students are understanding what services are available, or making sure they have access to internet or other devices. Next slide, please. We've seen examples, and I'm sure there are more and more around the world, but at least in the US, examples of schools who have been reorganizing their schedules to ensure that students get meals throughout the last couple of months when the majority of schools have been closed down. There have been affirmations from athletic departments turning on their lights to support the graduates for 2020. There have been these collective actions by students themselves who have been posting online choirs and online presentations. And this is a summary from one of our authors and former emerging leaders, that just in this sense of anxiety and this sense of apprehension that we've all been experiencing, that teachers are skilled and they are the pedagogical experts to make sure that the students will catch up as best possible and when possible. But what we need to focus on initially is making sure that we try and minimize the effect of trauma, which is affecting our students and in fact infecting all of our school communities. And so even putting out these messages of support and messages of alignment, just to let people know that we are the experts and we can help get students back on the learning track. Next slide, please. But on the flip side, as I mentioned, we're also, and it's almost this mirror image that Nicola was talking about, as we start to boost up well-being, we're doing it as we're also seeing the effects of trauma not only increase, but also broaden across our communities. Next slide. And what's different about this crisis is that we've had trauma and we've had issues before, whether it's acts of violence in schools or whether it's earthquakes or natural disasters or hurricanes. But this is a crisis that is affecting everybody. It's not just affecting one school. It's not just affecting one group in the community. It's not just affecting the students. It's affecting everybody. And that's why this is going to be so different when schools start to reopen next month, at least in the US, or the next 2 months. And I also want to reiterate that we have had teachers and educators and education support professionals and public health and school health providers on the front lines for the last couple of months. And these individuals and these sectors have themselves been going through trauma, have themselves been had people in their families who they've lost, or they themselves have become sick. Yet these are the people that we are going to turn to when schools reopen to try and help our students to reacclimatize. And so we are going to see this swell of trauma as we start to re-enter schools. Next slide, please. And so going back to what I was saying initially about what are some of the things that we can do. As an educator, we can provide advice or direct people towards the health professionals. But there are certain things that we as educators can do ourselves that to try and minimize the effects of trauma. Now, fortunately or unfortunately, we have some experience in dealing with trauma. And so we can go back even last October, before this hit the majority of the world, we were putting out articles about how to deal with trauma in schools. And that was isolated incidents. And if you look through the list there, it's about providing structure. It's about providing safety. It's about providing things that students and teachers can cling on to. It's about developing relationships. But ultimately, it's about going to the well. And what we mean by that is we are not alone as educators. We are now part of a system and part of a community, and we need to keep on expanding and enhancing that community as we start to open these schools up. Next slide, please. So we're recommending that teachers continue to build this relationship with their students and their families. So the things that they've done over the last couple of months, online or virtually, or even going door to door, that should not stop when schools reopen, even if they're reopening on a hybrid model or on a virtual model or an online or even face-to-face. Continue that development of relationships, but also grow and nurture those connections between services and agencies. These relationships that people have developed between schools and their services need to continue. Next slide, please. And next slide. Now, in summary, there will not be one solution that fits every school. And so what we're also looking at doing is we're also looking at seeing how we can learn from others about what successes they've found. And it could be others from across the world, not just across the US. So we're seeking greater communication and collaboration. Next slide. And we're already starting to see this occur in the US. This is just an example of headlines over the last couple of weeks as schools start to prepare for reopening. We are seeing an understanding that health and education and health sector and education sector need to work together. There is this understanding that social emotional supports are going to be key. Next slide. And so to sum up, a couple of key points. Health and well-being are now, at least currently, core components of any school reopening, and we need to harness that relationship. Health and well-being are also being recognized by educators as being foundational. And health and well-being are also viewed by schools and their communities as not just being about physical health, though that is a key part. It's also about being focused around mental, social, and emotional health. So this is a time where we need to harness these relationships, build on this intersector collaboration. And as we say in that quote, we need to plan what our schools and what our communities will be like from here on. And this is actually an opportunity, though it's an opportunity that none of us actually wanted to occur. Okay, next slide, and I think that sums up. Thank you very much, Didier.
Thank you very much for this very impressive talk. You know, I think that the idea is that we do not have to waste this good crisis and probably take advantage of this crisis to think together about the question of Maslow and Bloom. So now I'm go back to Sylvia. Sylvia, what are the questions? What do our attendant say about this future of the school systems after the crisis and the future of education in general?
Thank you, Didier. I have two questions. They're also related to the current crisis still, and not per se after the crisis. So one is from a participant from Kenya, where there are huge classes, about 300 students in a class with one teacher. And there's a real shortage of teachers, particularly in primary schools, which could be especially the vulnerable kids. And their question was actually for Education International, what the position is on Education International for this. And another question was how payment of sick leave is regulated for teachers if they are infected by COVID during their work.
Thank you so much. In fact, there's a three questions. One is probably on the diversity of the school systems on the planet, and what could be the impact of the crisis, not only on the school systems of the wealthiest countries, but also for low and middle income countries. And it's going to be a question for you, Sean, first. The second will be for Nikki about the question of the sick leave. Do we have something about this issue, which is a critical issue in many countries, from the survey? And the last one is for Antonia about the view the unions and Education International have of this question. Sean, what's your vision? What's your vision? I know that since you have the big boss of global outreach, you have a very global view, not only limited to the Western systems.
Yeah, and there is, as we were saying in one of those slides, there's no one answer to say, yes, this is the answer and this is the path you need to go on. And so I think we're going to learn how we can cope and how we can ameliorate some of the effects of the most disadvantaged by learning from various countries going through this. Unfortunately, whenever we get hit by these crises, it's the most marginalized and disadvantaged communities that get hit the hardest. So yes, we need to focus more attention. I don't have an answer exactly about how you can start to ameliorate the issue of having 300 students in a class. I think that's going to be an issue which will take some great innovation. What I will say, as I think can be a positive coming out of this, is that I do think this will start to change the understanding of what an education is about. If you believe that an education system is only about content delivery, then I think this is going to change your perspective. The way that we believe education to be focused is education is about developing the individual to be ready for society. And so that includes their sense of belonging, their relationships, their social emotional development as well. And so the more we can focus on that as part of an education system, the better.
Thank you so much, Sean. Sure, we won't solve all the educational issues on the planet, including the teachers' shortage, but clearly this question of the good balance between Maslow, it means the well-being of the students, and Bloom, what we really want them to learn and to know, is absolutely critical for, I would say, all the different systems. Nikki, do you have some information about this question of the sick leave in the survey?
I have a feeling that this is a developing issue, because what came through around absenteeism generally was that as the schools were closed in haste and that we were moving towards the end of the academic year in many countries, that, you know, things went on as normal. So if somebody was being paid, you know, a salary, that, you know, I don't think there was any question that things would continue, and everything was left to people to volunteer to come in and that would be accommodated. I think it's going to be a very different question in September and where the other school terms start, that I think that there will be more discourse about, you know, right, okay, so we have to think about what are these long-term arrangements. It was also notable that people referred to the disruption of teacher training and the internships that some countries had, you know, where teachers would be able to come in and learn, and how that's been disrupted this year as well. Maybe Antonio will speak a bit more about that, the educational opportunities for teachers getting more into the profession.
Thank you so much for your reply. And clearly it's a second phase after the school closure. As far as I know, in some countries, this is the same system as for the other professionals, but it's yes, it's a developing issue, and we will of course update our website when we're going to have the reply to such a question. Antonia, your vision, your position, and please, all the participants, do not hesitate to go to www.wooclap.com/13 July 2020 to share with us what are the best levers to improve cooperation between education and health. Antonia?
Thanks so much. So class size is one of the issues that EI and education unions have worked on for decades, and we've always argued that you cannot provide quality education with 300 students in a classroom. UNESCO is recommending a cap of 40 students per class, and that's also the basis for current estimates around the shortage of trained and qualified teachers. And we know the shortage is dramatic already. It's not, as many think, something that's only the case in low-income countries, but it's actually dramatic in many high-income countries too. So it's a truly global issue. How can we make sure that we have enough trained and qualified teachers? So that's the starting point. That was the starting point before COVID-19 hit. And now we are obviously faced with a situation where 40 is going to be too much in many schools, where if you practice social distancing, you will have to look at much, much smaller groups. We've seen some schools having shifts, trying to address class size in that way. We know that that's a difficult arrangement as well, particularly for teachers. It has workload implications. It has implications for students as well, and for the kind of education that they are used to all the social interaction and arrangements around school. So I think we are really looking at one of the biggest issues, looking at how we can balance the need for ensuring quality on the one hand, and meeting the health and safety requirements on the other.
Thank you so much, Antonia. It's very clear. Now, please, Sylvia, can you share with us what's the point of view of the participants on the best ways to move forwards in terms of collaboration between the health sector and the education sector? Oh, I think that all of you can see that there's a lot of things around, yes, the local level, but also the national level, the question of transparency of the needs, the guidelines to the continuous education of teachers and probably other professionals, a listening agility, openness, and a resilience, collaboration, a lot of means, and also the fact that we also have to think at the health professional in the school system. So there's kind of mediators between the school systems on the one hand and the health sector on the other hand. These are the health professionals in the schools, and also, of course, the role of the unions and the role of the different key actors in the field. Of course, all these good ideas and contribution will be shared on our website. You will have access to the PPTs and the presentation of all the speakers, also access to the guidelines created by Education International, also access to the report of the survey, which was led by Nicola Gray on the website. Now, we have to move to the last speaker and the last contribution, the one from Antonia from Education International. We'll ask her the question about, you know, the guidelines and the way in which we are able or not to support the people in the field. So this is the way in which we're gonna close the webinar today. So let's move to the question, and don't forget you will also have to contribute to this last part of the webinar. So the question we asked to Antonia is about the perspective of the teacher profession on the pandemic, and the question for you, dear participants, is how much attention did each of the 5 pillars, and Antonia are going to describe the 5 pillars of the guidance on reopening schools and education institutions receive. So again, go to www.booklab.com/13 July 2020, and after having listening, what are these 5 pillars? If you don't know them, please tell us how much attention did they receive. Antonia, that's your turn.
Thanks so much, Didier, and good morning, good afternoon, good evening to all of you. So Education International is the voice of teachers and education support personnel. We represent about 32 million teachers and education support personnel all over the world. And what I'm going to talk about here is how the profession sees the reopening of schools and education institutions. And bizarrely, I'd actually like to start by underlining that in too many countries, educators have struggled to make their voices heard in the conversation around how to deal with the closures to start with, and now in the conversation around how to go about the reopening of schools and education institutions. And what we did, one of the things we've done to assert the voice of teachers and education support personnel was to publish 5 pillars, pillars that the profession thinks have to be addressed for any school to be reopened. So I'm going to talk you through these 5 pillars, and under each of them I'm also going to mention a couple of examples of what unions in different countries across the globe have done. We are actually today launching an exciting document, a kind of further guidance under these pillars, where we're trying to illustrate some of the work that education unions have done. And frankly, it's an impossible task to try to summarize all the work of our members in these past months. So what we've done is that we've gathered some of the examples, and we are promising to update this document as we're moving forward and as the situation also develops. So the first pillar is, of course, engaging in social and policy dialogue. This is all about involving educators and their unions in all of the considerations related to education and COVID-19. So this is about agreeing on the health and safety measures for both students and staff. It's about agreeing on a framework for transitioning back to on-site teaching and learning. And it's about looking at teachers and education support personnel not just as components in an education system, but as human beings, as rights holders, as people that have a right to have a say, that have a right to have their working conditions, their labor rights respected, also in the middle of a pandemic. And examples here, I do want to underline that here's quite a few of both positive and negative examples under this pillar, because as I said, it's been a struggle in many countries. But I wanted to highlight Argentina, which is one of the countries where we've seen a collective agreement looking specifically at the working arrangements in the pandemic. And it includes a concept that we might have to have another webinar about, the right to disconnect, which is a fascinating and an essential conversation to have in these times. Denmark is another country where we've had legislation on what they've called emergency teaching, so very much recognizing that teaching in a pandemic cannot be like teaching in normal times, but this is an emergency situation. And then I wanted to mention Zimbabwe, where the unions actually took the government to court when the government wanted to reopen schools in order to have exams. And the unions were arguing that there is no way we can ensure health and safety reopening at this moment in time. And the unions actually won the court case. And then the next pillar and the next slide is looking at health and safety. Not very surprisingly. And here what we're calling for is really agreement, but also clarity on the hygiene measures, the preventative measures for containing the spread of the virus, but also keeping everybody safe and healthy. And what we've seen is that a lot of schools have struggled to access the equipment necessary to comply with the rules and regulations agreed. So many schools struggling with access to water to start with, not then to mention hand sanitizers, personal protective equipment for teachers has been a struggle in many countries where teachers have been asking for that. Here we're also underlining the necessity for training, so making sure that staff, teachers and education support personnel are aware of and understand what the regulations mean in practice and how it changes impacts on their daily work in school. And here we're also underlining that additional funds and staffing is very likely to be needed. So that has to be ensured. And we've had a couple of examples where additional staff to do some of the cleaning has been ensured. Denmark would be such an example. But we also have a lot of examples of countries where teachers end up using their time to do all of the cleaning. And in many cases, this is actually quite a significant amount of time that has to be devoted to this on a daily basis. And here I could spend a long time mentioning all the countries where unions have put together their own criteria, checklists, guidance. Uganda, the UK, Chile, France, so many unions have published their own checklists. Many have also distributed equipment themselves, such as hand sanitizers, traveled the country to distribute them in different schools. And very many unions have had different support services for teachers. So in Nepal, for instance, there were training workshops where the union was trying to make sure that all the teachers would actually understand how the virus works, and at least what we know at the moment about how it works. In the Philippines, the union had a hotline where teachers could report different health and safety problems, and where the union could then provide them with advice on how to address these problems in their schools. The third pillar and the third slide, this is looking at equity. And I don't think it comes as a surprise to anyone that it is the already vulnerable students and teachers and education support personnel that have been most affected and who are likely to continue to be the most affected. And while this has been recognized in very many contexts, we are yet to see the specific measures taken to actually address the inequity of systems. So what we're calling for is support structures to support those who are particularly vulnerable. Those, for instance, who have struggled to participate in any of the home-based learning. And there's been a lot of examples, actually, unions working to address the digital divide. For instance, in India, there's been a push where teachers have recorded audio lessons that they have then sent over WhatsApp to the parents, so that students who don't have their own devices can still benefit from some of the classes. In Nepal, they put up a special phone line, a toll-free phone line that students sitting exams could use if they had any tech problems, or if they actually didn't have any device at all and wanted to use the phone line to do their exam. We also know, and this goes back to the question that was asked before about indigenous peoples and indigenous students, we know the union in Mexico has produced videos in several indigenous languages to really try to make sure that the different barriers that exist are dismantled. And we know that in Lebanon, the union has been working with children in refugee camps, trying to ensure that they have access to at least some education in these difficult months. And I think they've done both televised and also phone-based classes, actually. But part of equity is also looking at the groups that are likely to drop out and making sure that there is a framework for identifying those who are at risk or who may already have dropped out, and a strategy for allowing them to come back to education. The fourth pillar, and the fourth slide, please, is looking at physical and emotional well-being. And what we've seen is many unions having well-being at the very, very top of their requests and their demands towards their governments. Brazil, Honduras, India, again, I could spend a long time mentioning countries where this has been really at the top of the demands. And really, most of them have been calling for psychosocial support for students as well as teachers. Here we had a survey done in Alberta, Canada, where many teachers reported that the energy and motivation levels of students were decreasing on a weekly basis. So the longer schools were closed, the longer students were expected to learn online. The more tired they got, the less motivated they got. And at the same time, the Alberta teachers were talking about something that they called compassion fatigue among teachers, and just the emotional toll that it takes to see the impact of the pandemic on their students, and struggling to get in touch with many of them, struggling to maintain that regular contact with their students. Many unions have, of course, also looked at workload and the link between workload and well-being. Norway, the Netherlands. In Norway, they also looked specifically at the workload of school leaders. And that's, of course, also a group that has had a considerable increase in workload over the past months. But in our guidance, we also talk about the need to really look at bereavement counseling, for instance, in communities where very many students will have lost someone, and really looking at dedicated psychosocial support and counseling. And of course, this has been a long-term demand for many. And I think many of our members would also report that there's been a decline in the services offered over the past decades, often referring to funding and cuts in funding, specifically in this area. And just highlighting that as both teachers and students, education support personnel return to school, it will be a difficult transition for everyone, and just the need to think about well-being in relation to the transition and the adaptation to new routines, new restrictions, and what that means for our ability to transition back into on-site learning. The last pillar, the fifth one, and next slide please, is about trust and about the professionalism of educators. And here we're really asserting that any framework for transitioning back to on-site education must be built on trust in the professionalism and in the pedagogical practice of the educational workforce. So that should be the guiding principle. And what we would like to see is education authorities engaging with teachers, education support personnel and their unions to really look at how do we transition, how do we find a balance between on-site and online learning in some contexts. How do we ensure quality teaching and learning, as well as well-being, as schools reopen in many parts of the world over the coming months. We're also looking at assessment as an area where very many unions have made statements, had campaigns. It's been a contentious issue in many countries where authorities have often, if generalizing a little maybe, been quite keen on reopening schools so that national exams can take place as planned. And in many countries, unions have been calling for such exams to be postponed, arguing that knowing the digital divide, knowing how inequitably teaching and learning has been over the past months, having students sit exams now would only further an already dramatic gap. So here I would mention Kenya, I would mention Germany, I would mention the Caribbean Union of Teachers. But I would also, looking at examples, talk more broadly about the work that many unions have done, stepping in when there hasn't been government provided support for teachers. Unions have stepped up and provided all kinds of online trainings, online courses, mentoring, peer-to-peer learning. Many of them have looked specifically at teaching and learning remotely. How can we use online tools? How can we use different platforms? But very many of them have also looked at well-being, at trauma, at that more social side of dealing with the pandemic. And again, workload issues is massive. Many unions have done surveys. In Sweden, there was an interesting survey that looked at workload, but also the implications of the shift online on a pedagogical practice. And there was some interesting data as well, teachers reflecting on what the long-term impact of this would be. And actually a very, very large group of teachers fearing that teaching as a profession will become less rewarding if it is further digitalized as a consequence of the pandemic. Some were also worrying that the status of the profession was going to decline as a direct consequence of the digitalization. And again, this is maybe a conversation to have in another webinar, but the implications of the shift online on the pedagogical practice is a conversation that I think will continue over the coming months, and where we hope we'll have more evidence and more examples to share. So those would be EI's 5 pillars. Those would be some of the examples, some of the work that unions all over the globe have been doing over the past months and continue to do. I know many of the union leaders are participating here in the webinar as well. So do challenge me in the comments. Do add examples if you feel I missed something crucial. And yeah, I look forward to your questions. Thank you.
Thank you so much, Antonia. We will go to the question and asking Sylvia where we are, but don't forget, dear participants, to contribute just as Antonia just said, using the www.booklab.com/13 July 2020. Sylvia, questions, that's your turn.
Thank you, Didier. Yes, we've received several questions. The first question is if Education International has foreseen in an obligation of governance to provide protective and preventive equipment and materials for teachers and students. Second question is related to that. Not all children have access to internet, computers, basic health services, etc. And how can we ensure that the basic principles of education, health, and food are respected by governance? A third question is that countries should adopt public policies with a strong investment, not only to condition schools, new jobs, but also awareness campaigns for the educational community, for students and families to generate more tranquility and a better climate. And the role of the media should also be part of this cooperation. And the last question I have at the moment is that the terms educators are used, but you include do you include medical social personnel as well? Because for many teachers, we are not only educators but carers, and finding our place is more than complex at the moment. Thank you.
Thank you so much. Many other questions about the role of the media, the role of the health professionals. You have around 20 seconds to answer these questions. No, please, very, very brief answers because we are late at the time. So Antonia, your point of view and the key questions.
Okay, so I'll try to be very, very brief. On the equipment, what we've said is that whatever equipment is deemed necessary in that context has to be guaranteed, because we wanted to recognize that, of course, different countries are in very different situations. However, the WHO does recommend guaranteeing equipment to all frontline workers, and we would argue that educators are frontline workers, and as schools reopen, this is something we will really have to look at. Access to internet remains a massive issue, and I think we are seeing an interesting conversation around access to internet as a right, looking at the role, the obligations of governments. If it's the case that we need the internet to access some of our rights as citizens, surely that needs to be guaranteed. At the same time, we also see many countries rely on radio, many countries rely on TV. So it's not only the internet that's been used, but the digital divide remains a massive issue. And I think here again, it's so important to remember that it's not only low-income countries, which is sometimes the impression that is created, but the digital divide is fundamental in high-income countries too. And in many families, when several children, possibly several parents, are expected to have their own parallel online meetings and classes, it's just practically impossible. So access remains key, and access will remain key in case we have a system of parallel on-site and online learning, where some part of the class is learning at home, part of the class is physically in school. We will need to look at how that can be done.
Thank you very much. We have to conclude the meeting. So, Sylvia, can you share with us the contribution of the participants?
Yes, of course.
On this last question, and then I will come back to our speakers. So, where are we? Okay, so as you can see, this is on a scale of 5 degrees, and for the participants, the pillar number 2 and the pillar number 5 are probably received much attention than the others. I'm a bit surprised by the fact that colleagues think that the professionalism of educators receive attention. I feel from the survey that it's a big question for a lot of school professionals. And of course, not to mention that educators, it's not only the teachers, but also the nurses, the school doctors, the social workers, the principals, and all the people working on schools. And few, of course, the question of health and safety is probably more important because there's a lot of communication, and that's not the case about the question of the dialogue with the professionals and especially the unions, which is a huge concern probably at a global level, and also the issue of equity and support. Just one conclusion, Antonia, about this, the vision the people have on the way in which the pillar received attention.
Yeah, hard. And surprising to see that actually it's very, very even if you compare the vote, the numbers of all the pillars, and it would be, yeah, maybe we need a follow-up webinar, because it would be interesting to see whether the question actually should have been framed differently, whether the question itself allows for very different interpretations.
Sure.
But I guess we should be very happy to see the 5th one so high up.
Yes, it could be probably one of the best wish after the crisis, to see the trust in the professionalism of all the educators increasing in the society in general. As you remember, the key question of this webinar was about the intersectoral collaboration. And you remember that the participants consider on a scale of 10 that it's about 5, it's in the middle, it's just in between. Just a very, very, very few words of conclusion about the best way for you to improve the collaboration between the two sectors. Nicola Gray, your conclusion.
Yes, before the pandemic hit, we were already working together on trying to think of different ways for health professionals to be in schools, like catalyzers, like making connections. And, you know, the pandemic has really brought that into focus for us, you know, that if there is stronger working, then, you know, some of this advice, some of this training, and indeed, you know, assessing the well-being of, you know, of all the different parts of the school community might have been better and might be able to go ahead. So I think we have to stay on our track of trying to think of health professionals as being more than you know, a doctor or nurse who provides a narrow range of services or provides a curriculum piece around drugs of misuse. So I think that will be my hope going forward, that we think much more about the outcomes of education and health and bring them together.
Thank you so much, Nikki. Sean, your conclusion about the best way to improve the collaboration between health and education sectors?
I would probably echo what Nicola was saying. And just to ensure that, one, everybody takes this opportunity to make their voice heard and to advocate for the role that they play in nurturing and developing and educating the student. And to also understand that we don't want this to be something that gets resolved temporarily, and we don't then have systemic changes on the way that we actually have these sectors work together. So let's make the dialogue sustainable and long-term.
Thank you so much for this very positive conclusion. Antonia?
Yeah, building on what was already said, maybe bringing in one aspect that we didn't touch upon yet, and that's the necessity of quality public services and the power of health and education to maybe move forward hand in hand, fighting for public funding of quality health and education systems with trained, qualified, supported workforces.
Thank you so much. I would like to thank all the participants. There's a lot of contributions just recently from Argentina, from France, from Kenya. Be aware that you will find all the contributions on the website. Next week you will have the videos of the different talks. You will have all the resources, the document, the presentation, but also all the contributions, all what was said in the chat box and your question contribution and what was produced. Thanks to all of you, thanks to the speakers, thanks to the participants. And of course, it's just the beginning of a new series of webinar. As Antonia said, there's a lot to do, there's a lot to say, there's a lot to share. And we will probably have more webinars on different of these topics. Thanks to all of you. Have a nice day or have a good night. Bye-bye.